Hello everyone, I just thought I would give an update. So I can't remember if I actually talked about this in my last video or not, but I am actually freezing my eggs, my fertility eggs right now, and so I'm going to make another video showing just kind of the preparation. It does include 10 days of subcutaneous hormone injections, and so today was day 6, and on day 5 we increased one of the two that I've already been taking and added a third injection, and it's likely that in 2 days another injection will take place, so I'll have a fourth one, which will be HCG, but that one only happens once. So the whole reason I'm doing this is because when we met with the chemotherapy oncologists, they essentially said that chemo puts you at risk of infertility, I guess, and so they talked to everyone prior to starting actual chemotherapy about fertility, and I was really caught off guard. I didn't expect that to be a part of the conversation, but of course, like, my sister, who's on her third pregnancy due in like less than 2 months at this point, had all the right questions to ask and got me set up for an appointment. I also got shingles at the same time, so it's just kind of crazy how this stuff happens, which usually at my age, that's pretty young, though some people get it when they're like a teenager. So right now I've got this nice itchy spot on my side, and I'm also doing subcutaneous injections near my belly button each night before I go to sleep. So I just did 3 injections. So 1 out of the 3 was doubled in dose, and now it's 150 milligrams instead of just 75. And then a third one was added last night. I'm going to have another video coming up shortly where you'll see me get ready for this. But I just thought it was interesting, and that a lot of people probably don't even know just how at risk you are for infertility or just like a change when you're taking chemotherapy, that it could affect whether you'd be successful or not. I don't know if I'm going to have kids ever, but Kyle, who's my boyfriend of over 5.5 years at this point, we talked about it, and he's very supportive. So we are freezing my eggs, and so like I said, this was day 6. I just did the 3 injections, and so today is Sunday, and likely on either Thursday or Friday they'll actually remove my eggs. It does count as a surgery, and the fertility clinic that I've been going to, I've already gone twice. I go again tomorrow, and they'll check to make sure that I'm staying on track. But of course, like, I'm not actually infertile, and so I'm responding very well, despite the fact that I take all sorts of other medications since my surgery of this guy. So today is Sunday, and it could be Thursday or Friday that I likely have the outpatient procedure done. So they actually have an outpatient room in their building, but since I am one of the chemotherapy cancer patients, I will receive the operation at Barnes Jewish. There's potential I end up in the same OR that my last surgery was done, and then I have the same anesthesia team, the same specific anesthesiologist in charge of my case as a more severe type of patient. And so, like, a procedure that doesn't take much time, they'll keep me a little bit longer just to watch me and make sure everything goes well. And they remove usually at least 10 eggs. So yesterday I had 11 already on track, and I was barely halfway done. Like, it was day 5, but I hadn't even like done my day 5 injections yet. So responding very well, despite the fact that I also have shingles, also on 50 million other drugs. on top of the seizures that I have still been having. So it's like a good case scenario. They'll be frozen until I decide to pull them again. And I'll have a video to come where I show you kind of what I do. So just thought I'd share that that's kind of what's going on right now. And my first chemotherapy treatment is scheduled, as is my first radiation treatment is scheduled to take place basically a week after my aids are removed. So my first day will be September 7th, and my last day will be October 18th. So there's the 6 weeks, and then I get a month break. Woohoo! So that's kind of where I'm at right now. I've really kind of been taking it easy. I really did have a thought to make like a new YouTube video every day, but with the shingles plus doing the hormonal injections, I have been having a few more seizures than usual, and we did increase my Keppra, but at the same time, there's just a lot going on, and so just letting it all balance out, and just know to come will be a video about having your fertility aids frozen. 2 out of the 3 hormonal injections, I actually have to prepare the syringes, and then the third one already comes done, but there's like a big air bubble, so I have to flick that out. And then I'll also show you actually injecting it into my stomach. So it's subcutaneous, it goes near your belly button. And on day 8, I also do the HCG injection, but that will go into a muscle. So I'll share a video of preparing these and also doing the injections. So just something to look forward to. I hope you have a nice night and sleep well.